I think a recording is starting. I hope everyone can see the screen, and welcome to this session. Some of you would have joined council members where we actually did sort of bite-sized bits of IT. This session is designed just to expand that a bit broader, and obviously there's a different audience for this session. I imagine there's more reception, admin staff who's connected, so you're all welcome. The thing I would want to flag is please hit the chat. If you find that there's questions that you want to ask, please do put them into the chat and let's see where we focus. We should have someone from the NHS Apps team joining this webinar. So hopefully people can put questions in the chat and we can pick them up later. Can I just check? I'm seeing the chat comments that the sound quality is poor. Can people hear me? Is it clear? Or is there a technical end at my end?
Shankar, I can hear you fine. I think anyone who's having sound problems, if you can try leaving the meeting and rejoining, that often helps. And everyone else mute if you're not talking. Okay,
great. Okay, so we've got Ealing Standard, and as I go through this webinar, I just want to pull out the Ealing Standard bits that we're all thinking about, because obviously it's a bit of a broad document, a big contract. So let's look at digital standards around access. So I've just put in bold, I know it's a bit busy on the slide. Around access, we're talking about promoting patients the option of video consultation. We're asking you to promote the NHS app and the Airmid app to both patients, and maybe even considering bulk text to promote them. That's on around access. In medicine safety and optimization, I am the medicines management lead. We're asking you to really understand and promote the use of both of these apps for patients requesting repeat medication, and that your staff know how to use these apps to request medication. So let's go on to the first app, NHS app, and then the second half of this webinar, we'll talk about Airmid. I know that we've titled this as AccuRx. We may signpost a little bit for AccuRx, but I think we may run out of time on picking up on the AccuRx elements. So let's head off with the NHS login. Do we all know what the NHS login is? It's the front end of the NHS, the digital front end, the secure way that a user can verify themselves. And the vision for this is that different parts of the NHS may use the same NHS login. I really do compare this to a bit like having a Facebook login that can access different websites. Some of you may have seen some of these clips in the previous webinar, but here you go again.
So we're going to provide a single way for people to prove who they are once, and then give them a single login that they can use to access a range of apps and services in the NHS. The thing that's really important for us to do is to link a person to their healthcare record online. To do this, we're going to follow what's pretty much becoming an industry standard. You might have seen it in banking, where you're going to take a photo of a trusted or official identity document, and then to prove it really is you, we're going to get you to capture a short amount of video of yourself so we can compare the two.
Okay, so just a bit of an introduction, but who can use the app? Anyone who's registered with a GP surgery in England can use it. If they're aged 13 years and over, they can access it and use it. Although in the age category 13 to 15, they may need you to do something on the system one end so that they can use the app. But you need a UK mobile phone number to do this. So it won't work if you don't have a UK mobile phone number. I think the development team are working on solutions for that, so that cohort of patients who don't have a mobile phone can still use it, but at the moment that is a requirement. And once they are registered, if they still are registered with your practice, they can use the app anywhere outside the UK. So this could help with some of that dilemma we have when our patients are abroad and they want access to things. And we think, well, are they really actually entitled to our care once they've left the UK? The app does give them some access to things like record access still when they are outside of the UK. This is a video done by a GP. And I think one of the key things is to actually understand that NHS login experience. I think that's the main challenge of navigating our patients through it. The NHS app team have not actually made any videos at the moment to show this. So this is a video made by a GP. I don't know if you already know about eGP Learning. It's a GP that who tends to make lots of videos and post them. So let's just see the NHS login experience.
Loaded, then you just open the app itself. And this is the interface that you have when you do so. So you can check your symptoms without registering and stuff. So to do so, click check symptoms, and it gives you the option of A to Z of treatment conditions, which you can search through, as you can see here. So clicking on it, and then it's got a variety of different health conditions that you can look at in terms of information. And this is information from the NHS Choices website. Alternately, you can ask if you need urgent help. So click on there, and effectively you'll be able to then check if you need any medical help. So for example, where to get prescriptions, for example, and it's got an algorithm that you follow through that gives you that information. It's fairly simplistic, but it is reasonably good. However, if you want to use the main functionality, then you need to register and create an account that allows you to log into the NHS app. In order to do so, click on the big green button, and then it'll ask you if you already have an NHS account, so an NHS login. If you click yes, it takes you through to this window that is effectively to register just like you would do with an email address. However, if you don't, you can click no, and it'll take you to set up an NHS login, as you can see here. And then simply to do that, you put your email address in, put a password, and then agree to the security documentation and stuff to continue. So we're going to join up once we've done that. When you've done so, it'll send you an email to your registered email address to log in. As you can see here, I just covered up my email address and stuff. And then you just simply click continue. Once you've got the email, just click on the link. Do make sure to check your junk folders to make sure it's not gone there by mistake. It is a very quick process, so it should only take a matter of a minute or so. And then simply you put the registration information here. So I'm going to do that right now. Once you've done that, it'll ask to send a code to your mobile phone number that you've used to register the device with. So just enter your number there. I'm just going to do that now. The system will then ask you to check your phone number and input the code, which is a 6-digit number, and then click continue. Let's do that now, shall we? The next screen will ask you to prove who you are so that you can use the NHS properly. And this is obviously for data security purposes. So therefore we're going to do that. Let's continue. In order to continue, it will ask you to provide details from your practice to prove who you are. If you've used the surgery's online details before, then it'll ask you to put those information in. If you haven't, then it's okay. So I'm going to say no. I'm going to try another way. And at this stage, it'll ask for a photo ID. So it'll ask to register that. So let's continue with that. So I'm going to suggest I'm going to use my UK driving license. And then it'll ask me to take a photograph of my UK driving license in order to do this. So let's do that, shall we? So it opens up the camera app in order to let me do that. So I'm just going to take a photo now of this, and then we'll come back to the next screen. And as you can see, it's now uploading my photo. It's important to remember that you can see all 4 corners when you're taking the image, otherwise the system may not be able to recognize the photo properly. So next it's going to ask to take an image of my face for a few seconds, and also me saying a few numbers just so they can verify face and the ID. Let's do that, shall we? So it gives you particular 4 numbers that you have to say. Make sure you turn the camera around. So this is my video, so you can see the numbers have changed just because I had to redo it to make the recording more effective. 5, 9, 7. And then simply you click yes to continue, and it uploads the video for you. So then asks you for your NHS number. I'm going to click continue. I don't know my NHS number like many people, so I'm going to click no. It's going to ask for my details, so put my name in, continue, put my date of birth. I'm afraid you guys aren't going to see this part. And then it asks for your postcode. Once you've inputted your postcode, it asks you to confirm the information and submit it. And then it lets you know that it'll be in contact within the next couple of hours. It normally takes about this long, but can be quicker. So GP learners, after a short while, they'll ask for you. So this is the code sent to my mobile number.
That video goes on to show a lot more of the functionality, but I think that's a bit that we really need to focus on, that NHS login experience. And you know, there'll be lots of patients who find that quite easy, quite straightforward, but that's their first barrier to get online. The the thing I think I would emphasize is that is a far more secure method than anything we were probably doing on our practice generating online logins. So if we were used to generating System 1 online logins, you know, they may have shown us an ID document, but how do we really know that that was genuine? So I personally have a lot more confidence in the NHS login as a method to securely verify the patient. But clearly there'll be people that struggle with this. So if you don't have the UK mobile number at the moment, although the NHS app team are flagging, they're looking at development solutions in the future, you're already not going to be able to use the Create Your NHS login. That video was some help, but I generally think that the only way to really understand this is to do it yourself. So, you know, in college-based surgery, I've encouraged all the staff to really do this for themselves as a patient perspective for their own registered GP. So the more we feel comfortable with it as users, the more we're going to feel comfortable with the conversations with our patients, knowing how it works. So what if you don't have photo ID? So firstly, that video was about a year ago. So, you know, the app may have changed a little bit over time, but you saw him highlight about these 3 pieces of data set that could be needed. A patient might contact the practice saying, I couldn't set up my NHS login. I got a message saying I need this information. Generally, if you create the system online sort of details, that document usually contains the information they need to complete the NHS login process. I won't cover how you create the system online login details. Hopefully that's your normal practice process. All I would emphasize is you've probably heard been mentioned about vouching information, because do we really want patients to come in and out the practices? Can you vouch for them over the phone? So just make sure you pick that up from Finn's really useful pack. Device compatibility. So some of our patients with older devices might not be able to use the NHS app, but it's not just a phone device. It is a website. You can go onto the NHS app sort of website, just using any web browser, and they get an experience similar to the app. So that's one advantage that this has. It does the dual purpose functionality. What can this app do? All of it you can see on this slide. So there's advice. It can give you this advice. The repeat prescription ordering that we're asking you to emphasize to your patients is possible through the app. Booking appointments at the moment, probably not as helpful because we're using triaging, but will grow in benefit. We need to pick up the eConsult pathway in a second. You can check your symptoms, access information from the NHS website, view your records securely, change your pharmacist choice. They don't need to bother the practice if they want to change their pharmacist. They can do it through the app, and register them for organ donation. And there's bits about how the app tells them their data has been used. It can do more than that based on what settings you as a practice decide to do. You can do messaging between the user, the patient and the practice if you've enabled it on your online settings on System 1. You can, the patient can access online consultations. eConsult, which we're pretty much all using in Ealing apart from one practice. eConsult is already now integrated with the NHS app. It was the first online consultation platform to integrate, and it's a seamless experience for the patient. They don't really see themselves leaving the NHS app experience. And the one other advantage is that you may have seen it if you attended my eConsult webinar, is that you also get an alert on the eConsult report showing that the patient was verified through the NHS login. So you can feel more secure that this was genuinely the patient who submitted the online consultation. And you can access more things, health information from wider field in the hospital. And pretty important for us in North West London is patient knows best. So you may be aware that your patients often can access hospital online information through, like, for example, Imperial Trust and other trusts in North West London, and they are using a product that's basically called Patient Knows Best. Think of it as a system separate to System 1, which is raw patient orientated, that they can access this data more. This was, again, one of the first services to go live with the NHS app integration, or the NHS login integration, for hospital data. So when we're promoting NHS app to our patients, we're not just promoting it for general practice, we're actually getting the benefits that they can access their hospital data too. So it might reduce the queries we get about when is their hospital appointments, what did that hospital scan say to me, so we get that benefit as well. So that's relatively new on the NHS app development curve. And what if you want to test this more as a practice? So like I said, get your staff to pay for it as end users, as patients, but you can email the NHS app team and ask for a test patient to be set up for your practice, and that's sort of spine enabled, so you can actually test it a lot more. So we've taken you briefly through the NHS app and the NHS login. I think a few other questions that have cropped up have been about, can children get access through the app? There is a setting of linked profiles in the NHS app, so a parent can have other profiles of other users on it, but you control it at the system one end, whether you grant access to children or not, for them to see that. So that's not a specific NHS app functionality control at that level. It's still controlled at the system one level, but the app user can control more than one profile on the app. I'm going to pause there. I want to just we've got Patrick, who's one of the NHS app implementation team, who I think is still on the call. I thought I'd just first offer for him to maybe tell us some few things that I may have got wrong, or we could emphasize more about the app and the development curve. So Patrick, do you want to come off mute? Is there anything you want to contribute?
Yes, hi guys. Sorry I joined a bit late. So is the audience mainly, is it GP or practice staff?
I think we've got a mixture. We've got a mixture of admin, reception staff, clinical GPs on this call. So I don't know if Jane can say how many people we've got on this call at the moment. I think we've got over 50, is it over 50 people?
I can see that. Okay, guys. So my name is Patrick Johnson. I'm implementation lead. I look after London. So I, even pre-COVID, was dealing with promotion of patient-facing services. And we know that the NHS app has only been available for around 18 months or so. So I've worked with some of the facilitators to promote the app in practice managers meetings. I've visited some practices, and I've been doing it from a patient versus services, whether it's system online or patient access, for about 4 years in November, which is what, next month. So in terms of the NHS app, you've seen, and Shanko's told you about some of the facilities within the app, and part of what I'm doing is really promoting the app. We've got beacon areas in London and across the country as well, where they're using the NHS app as a front door, and it's really about promoting what the facilities are, what the functionalities are within the NHS app. So some of the things that Shanko has gone through, which is more or less all that's there. So I'll talk briefly about some of the things that's on the roadmap in terms of what's going to be there. But just one thing to be aware of. Actually, just first thing is, I hope that everyone, if I was in a room, I was asked all of those who's got the app and downloaded it to put their hands up. And hopefully I would get usually 95%, but I won't ask you guys to put your virtual hands up. But one of the best way of finding out about the app is actually using it. So download the app, start using it yourselves. And as Shanka said, around the test patients, which you've got a slide in front of you, the best ability, I mean, obviously, apart from using it, and hopefully you can do that, you can also use a test patient at your own practice to get the look and feel of the app, and that's the best way. And when patients, there's lots of facilities, there's a help desk facility, you can do it offline, call the health service desk as well, but patients always ring up the practice most of the time, so it's good to have a good understanding of how to use the app as well. So one of the things to be aware of is that, as you know, the COVID app went live 2.5 weeks ago on the 24th, and what that means is that a lot of patients, they go to Google and they type in NHS app, and what comes up is the NHS app and not the COVID app. So we've had a lot of patients who have been downloading the NHS app inadvertently thinking that they're getting the COVID app. So we've gone through lots of means to try and correct that, so that even before they download the app, it says this is the NHS app, not the COVID app. If you need the COVID app, go there. But what it does mean is that we've had like a 4-fold increase. We usually have about 50,000 a week, and we've gone like to about 150,000 have downloaded it. And what it does mean is that the back office, what normally verifies patients when they've signed up to the app, is there's a delay. So Shankar mentioned the 2 hours. Unfortunately, that's gone up to almost 3 days now because we've had 20 people that's increased, but that's not enough to manage it. Every time there's an advert on TV, you open the newspaper, you go on social media, it's all about the COVID-19 app, and people are still saying the NHSApp. So there is a little bit of a delay at the moment. So just be aware of that. The patients might complain that it's taking them rather than 2 hours for the verification. It could take up to 3 days, but it does tell them that though, rather than the 2 hours. So in terms of, I mentioned around the Care Information Exchange, which is the PKB. I'm working on that. We go live on the 21st with one of the practices in Northwest London, and that's really, really good to know about because that's something that's going to be available to Northwest London as the first STP in London to be able to actually see that functionality within their secondary care and patients. So I'm doing a project that's going to be able to roll it out in all central London, and then we'll go to the rest of the other CCGs over the period of time. So hopefully by next year that should be available to everyone in Northwest London. One of the other thing also actually is that there's a functionality that we're releasing now. We've got the messaging functionality there, and we've got push notification. And to me, that's really, really exciting because you'll then be able to have the ability to send out push notifications to patients. So similar, if you've got your banking app, every time you go overdrawn, which is sort of on a daily basis for me, you get a notification that says, you know, you do realize you've gone over your limit and potentially you could be charged. So similarly, we're looking at a messaging gateway that will be able to control either via the CCG, the PCN, or even down to the practice, and also other suppliers like eConsult or PKB might want to send messages out. Obviously, that is a really, really good functionality and it could be abused. So we're looking at processes and around safety issues and protocol as to how that's to be used. We're testing it and making sure before we release that we've got a good idea how it will be used. But you can imagine for probably not for this flu campaign, but for the next flu campaign, for the COVID app, something like that, to be able to send out push notifications to patients is going to be really, really invaluable. At the same time, we realize there's only about 1.5 million patients that's downloaded the app, but it is definitely a start. So I don't want to go on. If there's any questions, I can answer it, but I just thought I'd give you a little feel of what's on the horizon and what's here at the moment.
Patrick, I thought that was really, really helpful. It's just nice to hear that feedback, especially about knowing about the delays and so forth. So that's great. What do you know any sort of like what the uptake is in terms of demographic? You said 1.5 million patients have got it. Do we have any sense of the demographics of that patient that have, like obviously everyone's thinking about inclusion. People can be skeptical about it's only one type of patient. So do you have any information on that demographic?
So there is a really, really interesting dashboard. So they call it NHSApp dashboard, and I can send you the details, and anyone can download. If you've got an Okta account, you can get access via Okta account. If you haven't got one, you could just register for Okta and you'll be on in the same day. And that gives you a lot of information. I'm not sure whether it breaks it down to demographic in terms of, the sex of the patient or the age and stuff like that. I'll find that out. I know that the dashboard is being constantly updated. At the moment, it gives you usage information in terms of what patients has used it for, whether it's appointments, record access, order repeat prescriptions. So that's usage. It also gives you uptake right down to practice level. So you can see right down to your practice in terms of how much people have downloaded the app and registered for it as well. So the dashboard has got a lot of information on it, but demographic information is something that we're aiming to get. I'm not sure if it's there yet, but I can find out.
Okay, great. So look, if everyone, I think Patrick's is only, he may have to leave to go to another meeting or something else, but I guess if there's questions that people want to pick up in the chat, we can try to collate them and see if we can answer them. So please do hit the chat with questions, but I just want to say massive thanks. Literally, Patrick just came in last minute. He's been really, really helpful. He only knew this morning that it was happening today, so I really want to reach out and say thank you, Patrick, for joining us.
Adam has got his hand up there.
Okay, Adam, should we sorry, yeah, Adam, do you want to speak? Or
it's not my hand as far as I'm aware.
Can you hear me? Sorry. Can you hear me? It's Adam from Hillview.
Okay, yep.
Yeah, it was a very quick question on the NHS app. I know you mentioned the dashboard there, which is very useful because that's something I've wanted to find out. Is there a way to report on NHS app uptake on System 1? Does anybody know? Or is that currently only via the dashboard?
We've been asking that question. I think Phil can come in, yeah.
Brilliant. Thank you.
Because
there is no current way you can report on that. We're in System 1.
Brilliant.
Yeah, so that's why at a CCG level we already can have sight of that dashboard, and I do think it is useful at practice level. So I think Patrick's comment about how to roll out, how do you get to see it, is really important for practices. So we'll definitely follow that up and cascade out guidance once we become clear.
Brilliant, thank you.
Okay, I'm going to
jump off, so thanks very much.
Okay, thanks Patrick.
Yes.
Okay, so the second half of this is about Airmid and the System 1's new app. Not quite so new, it's been now around since the start of COVID, back in February, March when they started to launch it. I'm just going to recap, and I'm sorry again for repetition if people have heard this in other webinars, but it was originally going to launch this autumn. It was brought forward by the company TPT, so System 1, because of COVID. So they have, so when it launched in March, it is having lots and lots of updates happening, and so it's constantly evolving. So anything I say now could be changing next week. Why do we need to promote it, or why we asked you to promote it? In our practice, Cloister Road, we had some people saying, can't Airmid do everything? I think Airmid's so much better. Why are we promoting NHSApp? I know I had a conversation with Adam at Hillview the other way around saying NHSApp seems to do everything. Why are we promoting Airmid? So I totally understand that confusion. I think there are development bits of Airmid which NHSApp we cannot see are going to reach in the near future. So first thing is video consultations. Secondly, around patient entering their own data into your System 1 environment. And then the third point that we're going to cover is doing it in a more structured way where you could publish things to your patients to complete on their app. Fourth thing, Airmid conversations, I'm going to say that's a bit like a WhatsApp conversation with your patient, but with some safeguards, and then record access. So we're going to just touch on this, and it may be a little bit confusing that I go a little bit too fast, and I apologise for that. Why do you want to look at it? Well, obviously, yes, again, there's your contract, and Adam's on. It's really good when you have Adam on the call because he could say that whatever I'm saying is correct. I really want to emphasize the digital standard is just about you exploring it, trying it. We're not saying you have to love it. We're not saying you have to roll it out to every one of your patients. We just want you to have experienced it now, thought about it now, not 5 years from now. So do not panic about this. So if we look at mental health, we've asked you, with just one of your patients, try maybe completing a PHQ-9 GAD-7 on Airmid. Already in the chat, I've actually uploaded the files of a template you could import into System 1 today. In later how you do that. We've asked you mental health, do a video consultation with anything. So you're probably using AccuRx at the moment. You must have received the email from AccuRx saying it's going to be a paid product from April 2021. At this point in time, we can give you no contingencies and no guarantees about whether it would be funded, who would fund it. The company AccuRx is communicating that they're contracting at the level of CCGs. If CCGs don't buy the product, they would only contract at the level of PCNs. They do not want to contract at the level of individual practices. So this is now why we really would encourage you to look at Airmid, just to look at it as could you do a video consultation. But on the digital standards, we're not saying explicitly it has to be Airmid. You can still use AccuRx, but it just makes sense just to try it once in case you don't have a sudden switch off in April. Then in diabetes, we're asking you to really encourage them to have full record access. And again, using maybe the Airmid app and the NHS app, and look at data entry. Could you get that diabetic patient to maybe enter a weight or blood pressure reading or something via Airmid? Could it be useful? And again, just one patient. You could just take one patient to do this. And then if that patient hates it and you share that feelings with your network, absolutely fine. We'll accept that. We're just asking you to look at it. With respiratory medicine, We've got wave 2 going on. Do you want to look at, if you have one patient that you want to do home oxygen readings and you've decided to give them a SAPS probe or they've bought one, do you ever consider them doing it on Airmid? Something you might want to consider. I'm not talking about the reviews or the safeguards, just that, you know, rather than over the phone saying, what's your saturation, you may still have the phone call with them, but you can actually see them because they've entered them into Airmid. Something to consider. And then hypertension. We're thinking about how do you get patients to monitor their blood pressures. Personally, I would think that I probably would be promoting eConsult for this the most, that they go to eConsult, they type in all their blood pressure readings and eConsult averages it out for you. But we've asked you to consider Airmid as well. And again, just one patient who may want to do one reading that works for them. And then you can just think what's the pros and cons of the different approaches. MSK, we've asked you to do video consultations. So again, do you ever do an Airmid video consultation? And then care planning, we've asked you to promote it really from the record access. What's the point of us giving us pieces of paper with bits of their results with diabetics and care plan reviews? If they've got their full record access, will that be helpful? Would that suit some patients? Okay, I didn't rig this, but I'm quite lucky. I think I've achieved in close-range surgery, we've already achieved our digital standard proof. So this is just one live comment, and I did not ask this patient. I have no idea who this patient is, but this is one piece of feedback that was left by one patient that proves that there is at least one person there in Ealing who thinks that Airmid's app has really helped them. So that's just a bit of proof, and I wish I had rigged it, and I promise I didn't. So bear that in mind. If there's a bit of negativity in the rest of it, that there is at least one patient in Ealing who likes this. So let's look at video consultations. So this is a bit of the official TPP video on YouTube. This is already dated. It's probably slightly better than this video suggests.
From here, we have patients booked into our appointment screen. Our patient sitting here is booked into a video consultation slot. By right-clicking over the patient, we now have the option to use email or SMS video consultations. The clinician can access the preferred option of communication with the patient. A pop-up information box appear on the screen saying if the link has been successfully sent. An email or SMS will now be sent to the relevant address. By selecting the link, it will take you to the web page. Within System 1, a passcode will automatically be generated. This can be copied and then pasted into the web page to start the video consultation. Within the web page on your device or your smartphone, you can then paste in the passcode. By selecting Log On, this will start the video consultation with the patient. From here, it will open up a new window. You'll be able to view yourself and also the patient you are doing a consultation with.
Okay, so a couple of things. I mean, it probably doesn't look as nice as Accurex as maybe your first reaction, and I'll say there's only one reason why it does it. Is that passcode bit. It's a PIN which you have to enter at your end and the patient has to enter in their end. I genuinely see no advantage of it whatsoever because it has no security. The patient, even if you sent it to the wrong patient, they get the PIN in their text message anyway. I've seen them, I mean, maybe Phil can jump in as well, but I've seen on the System 1 user groups that the company, I mean, I've tweeted about it, I've asked the company about it to remove it. I've heard that they probably are removing it, so hopefully they are. I don't know if we've got a formal update on it. But I genuinely think if they do remove that PIN number, this actually becomes better than Accurex because you can do it from your appointment system, right click, it's fully integrated. It starts to become a really good option. Until that, I can see why some users of us would prefer the Accurex video consultation experience. But there's another thing. They've communicated that group video consultations is about to land, and I think it's up to 30 people. So some practices have emailed us saying, can you do a group video consultation? We want to do group sessions. With Accurex, you can only have up to 4 people on the call. So this will be where Airmid can suddenly trump it. It does not need the app. A lot of confusion at the beginning and a lot of feedback from users that you needed the app. You do not need the app for the patient to have downloaded it to do the video consult. And I've just emphasised that it's integrated with your appointment system. Accurex does not have that. So you can do this for routine things in the future. And remember, one of the digital standard ones was even mental health. Could you offer a routine video consult? This is far easier to organize. It's in your appointment system rather than Accurex and reminders as well. So that's one thing about video consult. Patient data entry. So we're going on to the second bit of functionality, that the patient can enter data into the app. They see it as entering it into the app, and you can start to see it on System 1. It does not give the impression to the patient that you can see the data. So I think the clinical governance fear is we have, what if a patient enters a high blood pressure? Do they think that I then know, am I responsible for that reading? It does not give that experience or that impression. And I think if you tested it as a patient perspective, if you're registered with a System 1 practice and you ask for access, I think you can see that as well. You can separate out the data. It's not in your GP tab. Think of the patient as a partner in this, like, you know, we're sharing with community, we're sharing with urgent care. You can have another tab in your tab journal to control this, and you can control this per patient. If you have one patient you really think is not working, it's dysfunctional, you can switch it off, that you just cannot see it at all. My biggest bugbear, and which you'll hopefully see in the next example, is it's a little bit too code-based, not patient-friendly enough, which is why I would say, even from a blood pressure perspective, at the moment it's a bit clunky because it just gives you lots of codes you can choose from. But the company has said in their development that in the coming weeks or coming months, they are going to make that more patient-friendly. So hopefully that will improve. So where do you control some of these settings? So in organizational preferences on Airmid, if you look at online settings under Airmid, you've got firstly the default here, default to viewing patient enter data or not. So if you tick it, then the default is you can see all the patient's data entered on System 1, you can access it. If you untick it, then it's per patient control. So it's just setting where your default is. And then also about whether you want to send them notifications on Airmid. You saw Patrick talk about the NHSApp and notifications. You're probably used to your System 1 notifications. So it's just mirroring that through the Airmid experience. So let's look at how that data entry works. So this is a screencast of my own phone. I've registered myself temporarily with Cloister Road. I'm on an iPhone, so you can see that I've gone in really quickly because I had Face ID set up with my NHS login. And this is the home page. So first bit of feedback is a little bit cluttered. But if you look at the bottom, it says add reading. So Alex has mentioned in the chat about how do we roll this out? How do we get our patients to use this? What are the resources? I do imagine that such videos like this will help signpost them. And in the Actor Network, we're thinking about something like a digital social prescriber, which can do different things about how do you navigate the digital world. And do we just create a couple of resources that we share across Ealing? But here, again, I'm just showing you the menu on the left-hand side as well, and how you can access your records through on the left tab. So if we go back, hopefully I'm going to get on with it and start to show you how to add something. So if we look at add reading on the shortcuts, so come on Shankar, click on it, tap on it. This is when you wish you'd made the video with your audio recording. So I'm just typing in here pulse oximeter. So this is me thinking we're in second wave, and the patient's at home, and I'm saying I want you to put your blood pulse oximeter readings into the app. So there you go. So the patient can see also graphs of all their readings, how it's changing, but that's how they do it. They're just entering their data and it's tracked. They don't get like an experience that someone's informed or anything. It's just a way of entering data. How does it look from our practice side? So this is if you look at the bottom line of this screenshot, this is by the way, I'm registered with a Harrow practice, so I don't mind sharing this data. This is really me as a temporary patient. So the bottom line, you can see that I entered it on the app, and you can see the entry on this. If you notice, I'm in the patient app tab. So this is me looking at the patient app and seeing how it looks. So you can see it comes through and it can be coded. This may be a bit complicated, but this is a screenshot just showing me how you can create your own tab in your tab journal to really separate the patient app. And what I've done at Cloister Road Surgery is I've done it at organisational level, so everyone in the practice has the same experience, and that would be the recommended way that I would suggest you roll that out. And this again shows you the individual per patient control that you have. So if you look at here on the clinical tree on the left, on online services, so for this patient, which happens to be me, you can change your settings about do you use an organizational default about can you view it, or and if you untick it, do you control per patient that you don't see it? I'm just gonna skip this actually, because I think it's not as helpful as it could be. So that was just individual pieces of data which they're put in an unstructured way. What if we took it the next level and do it more structured? And here the example is a PHQ-9 or GAD-7. Surveys is what Airmid uses as terminology. I think in the old world of System 1, we'll be using things like questionnaires, but looking at the app interface, they're calling them surveys, and I think we should stick to that so we don't confuse our patients. How do we create a survey? It is just like any other data entry template or you have on System 1. So you know the templates that normally the North West London IT team are creating for us. You may have created some at your own practice level. So you create a template, and I did this in literally about 15 minutes. I took the North West London PHQ-9 GAD template and I just copied it. And the only tweaks I found was I had to just tweak a little bit the size of it to make it render quite well on a mobile phone. And it wasn't even that bad. I actually found that without any tweaks, the app handled it really well. I made a small tweak just to make it the layout and the formatting look even better, but it was actually quick. It was quick to copy that and do. So that was the design bit. And there's another tab now on your template settings, which is Airmid settings. So you've got this option, take ownership of data or not. So you've got the option when you do a template, if you take ownership, then you can, the data, if they've coded the data, will come into your rules, will come into your reports. So you have the ability to control that this data is absolutely separate, will not influence your reports, or you publish a template where you tick it, that you take ownership, and the data will come in your reports. So you have that ability to function it, and you can even see that you have the ability to restrict it to different reports. I know this sounds really sophisticated. I'm not expecting that any of us are going to embrace all of this really early on, but I guess I just want to highlight that the company is already thinking of all the fears that we may have about patient entering in data. It mucks up our quaff, and it was just a random blood pressure reading, and we get really irritated. So you have a level of control over this. And then when you create your template, you just are publishing it, and your new option is to your patient app group. So the one that I created really initially for cloister road surgery for PHQ-9 and GAD-7, I put it into chat. You could download it, you could import it. The longer term vision may be that at North West London level, we try to create some of the common ones. The North West London IT team, Phil and his team, they're working 24/7. They're really working crazily hard, like all of us. And I don't feel it's the capacity at the moment. We just don't know when it will arrive. So we may share things locally at Ealing, but hopefully the future direction may be that we have a North West London strategy, but it may take time for that to emerge. So let's just see how that looks from a patient experience on the app. So again, going into the app. In the shortcuts, so you can still see a bit clunky. There's a survey option. Sometimes they need to add that shortcut. So I can again see that there's a little bit of user training. This video was made a few months ago. It was a bit fast, but you probably saw the list of survey options. I ticked PHQ-9, but the patient will see the ones that you've published. They can also see two that System 1 published called the COVID templates. So on this one, on this template, these little tabs or pages, I just put some safety net in. I safety netted about, oh gosh, what if they get a high score, if they're in a crisis, where do they need to call IAP and the SPA number. So I put a little bit of clinical governance into that template. And this is just me tapping the answers. So I'm going for each one. I'm a GP, so feeling tired, I've put several days of the week, but everything else is not at all here. So you can see that I'm just quickly going through it. Apologies to those who saw this in council members. This is just a repeat of that data entry experience. But I hope those that the reception admin staff can on this call can actually see how this works. Okay, so that's it, and then the patient hits save, and it's sort of saved. And how does this look to us in the records? And you can see, I showed you this screenshot before, but that's how the data looks. So it can save us a lot of coding time, a lot of time entering things into the data if we get the right approach with this. Airmid conversations. So I know we're going to start running out of time, so I'm going to just speed up a little bit. But Airmid conversations is like your WhatsApp style conversations where you may have the fear. It has bi-directional conversations. It comes in as a task. You have the same control measures that you can switch on and off. And if I show you, I'm going to show you some controls actually. In organizational preferences, you've got the ability for Airmid conversations to enable it or not enable it, and then which users can receive the messages. I've just blanked out our staff names for confidentiality purposes, but you have that control in the actual organizational preferences.
I click onto messages. Here the end user, the patient, has the ability to look at previous conversations that have been had with previous clinicians. They can also look at archived messages that have been sent previously. So if I go ahead and have a look at my active conversation, I can see here that a message was written at 10:45 and a response was given by my clinician, Claire Butcher, at 11:22. Should the patient wish, they can then type a message back to the clinician and therefore send it back to the practice. If required, they have the ability to attach photographs, or take a new photograph or select from a particular gallery to also attach that to the message. So here we can see a new conversation that's been started from our patient. We can see it's new, it's come in as a new Airmid.
Okay, do you know what, that bit of the video probably didn't work, so let me just see.
In the app we talked about how you can have Airmid conversations. These come into the System 1 unit via a task. So here you can see details of a conversation we've had with the patient. These can be replied to by updating the task as normal. For medical.
Okay, so hopefully I hope you sort of saw the experience that the patient sees it through that. There is a disclaimer, there is a warning that says this is not for urgent problems or anything, and then us in the practice, we get it in as a task and we can reply back as a task, so we don't have to log into another portal or something to respond. So actually it can be really quick to respond. Maybe the fear is going to be that we just get overwhelmed because it's unstructured, but in terms of the speed and efficiency, it's good. Again, with the Acurex dilemma about do we know what the future is, you saw on that video that on a on the Airmid conversation, the patient has the ability to attach a photograph. There's obviously the information governance issues, the privacy issues, intimate areas issues, all those things we need to think through. I'm not suggesting at this point this at all. All I'm mentioning is that there is a potential functionality there. We just maybe need to watch that space. Okay, so hopefully we've covered the Airmid conversations, and we now want to document a record access. And this is where I think it does improve on NHSApp experience, that they probably have a little bit better functionality to see their records, manipulate their records, export their records, which again can reduce the admin workload. You know, do we just need to stop emailing patients? So when they say, can you email me a copy of your blood test results? Do we just need to finally say no and just start pushing it? Are we not making errors or risk of errors or sending the wrong things or just creating workload? If the app experience is good, is that not the solution? So that's something to think about. Some of you would have seen this video last week. This is how a patient can request through the Airmid app for access to their records. When you open the Airmid app, the first thing you need to do is access it using your NHS login. In this case, I've set up my iPhone to use my Face ID, so I don't need to enter it in each time. You will then see the home page, which just gives you access to particular functions, but we need to go to the main menu. So tap on those three lines in the top left-hand corner, and then you can see the main menu on the left-hand side. If you look at that first list, right at the bottom, you can see organisations. So tap on that, and then you can see the list of organisations you can access through this app. So if you then find your practice, so in this case Cloister Road Surgery, and tap on that, you can then see your settings for access to online services. So at the bottom you can see full record access, and there's the option to request access. So if you tap on that, it says this will send a message to the organisation requesting full clinical record access. Are you sure you want to do this? So if you tap on yes, and then you see that confirmation request sent successfully, and you can click on OK. Now that doesn't mean that you can get full access straight away, it means that the request has been sent to the practice, who then have to process it for you. So you still need to give it some time before you can then see your full record online through this app. Even that one bit is a functionality that NHSApp cannot do. On NHSApp, if they want to access the full record, they have to contact their practice through a normal method, which is a bit frustrating. And then when they contact us, how do you know that that is that patient? So this is another reason why I think Airmid is good, just to even promote that, because they will come through the NHS login, they will request their records through the app, and then you'll feel comfortable that that is the verification of the patient requesting it when you decide to activate it. Again, thinking about the Accurex potential, what do we do in a world without Accurex? Here's a video showing how they could access their certificate through the app.
Once you've done this, click on to save, and if prompted, select the location that you want to save it, and you can then close down Adobe PDF. To attach this PDF to the patient's record so that the patient can then access it on the Airmid app, we're going to use record attachments to do so. The easiest way to do this is to right click and copy the EMED3 PDF. Right click, add
Sorry, I'm just going to pull this forward a bit.
Save the patient's record. In Airmid, for the patient to now view and either print or email or send the EMED3 to their employer, they would, from the top left-hand corner, select the menu button. From here, they would open up the history section and then select documents. They can select all documents, and this will then show the most recent documents at the top. So here we have the MED3 that we attached, and the patient will be able to click onto this and open it. And you can see here, this is the digitally signed MED3 statement. Now, this will be slightly different depending on the device that you're using, but the patient will be able to either print this off or send the file, possibly via email or another method, directly to their employer. Once you've done this,
I mean, I sped up that video because we're running out of time, but I think hopefully you saw the functionality of that. They can quickly access bits of their records, their documents, forward it, download it, send it. That can actually become quicker than Accurex in the long term. You know, why do you have to, as an individual document, send it to them? Once you've trained those patients that they know they can use their records and access things, will this save admin time when they keep wanting bits of it? And is this going to be a growing trend when people want more and more bits of their record? So anyway, that's just showing you the Airmid functionality of record access. Then the future, online consultations, you know, if we didn't have eConsult or we use other products, could that grow in the Airmid app? What is TPP's plans in that space? And our patients are starting to have Google Fit and Apple Health Kit that integrates in, and it's interesting seeing how that data is. You know, I was fascinated to see what my phone was collecting about me that I had no idea. So where do we go next? Is this potentially a good way to receive certain patient data for help practices workload? Just a question. I'm not saying for all patient data. Is this an option for video consultations if we have a problem with Accurex funding? Could this be a way of tracking patients for the second wave of COVID? Could you use surveys to collect some pretty dull data sometimes that saves time when the patient comes in, that you've already collected it? And is our fear mainly that we get overwhelmed? So what we're really asking for you is that you start thinking about promoting both, understand the NHS logout experience, understand how they can request their records through Airmid, really get your staff to be familiar with what Patrick said, get them to play with it, really encourage them to play with it. If they feel comfortable with it as patients, they will, the practice staff team will promote it to all the patients in the practice. And there we have it. I know we've really come close to time. We've probably only got 5 minutes left, but happy to sort of pause and come off and let people jump in with either chat with you. So Alex, Finn, or Phil, is there any things we want to pick up?
Shankar, thanks for the run through. It's really useful. Just on, I had a number of questions on, not necessarily from this group, but offline about video consults through System 1 and Airmid. And you mentioned that you don't need the Airmid app to actually perform a video consultation through System 1. But how does that look from a patient perspective? And mainly I'm talking about this because a lot of patients are really not IT savvy at all, to the level of they can't even copy a PIN from their text message.
It's similar to the AccuRx experience. It opens up like a web browser window. And we tested it in Cloister where, first of all, with our test patient, we just put the phone number of another GP and we did a call. And then actually one really good nugget was one of the GPs didn't even realise she was using Airmid, started to just play with patients, just right click them and start a video consultation, and the patient's connected. So she didn't even think through what she was doing, but the patients had no problems using it. So I'm just saying that, I mean, we're still not using it in cloister road surgery. We're using AccuRx, but what I do think is it's not that bad. If they got rid of the PIN, I would probably use this in preference to AccuRx.
Okay, thanks. There's a number of other questions
Alex,
that we've
sorry,
been
just to jump in about the PIN. The PIN
Sure.
is there for IG reasons. That's what I was always told about the PIN, to make sure that you don't just forward it on to someone else to pretend to be you. PIN there to make sure
it doesn't work. Shall I tell you? The PIN is with the link, so it's basically, so you get a text message says here's your PIN and here's the link, so anyone's got both. It's a bit like saying here's your credit card and here's the PIN number for the credit card. It has no security, and if you think about what we do generally, AccuRx doesn't do that. When we pick up a phone, we phone a mobile, we don't ask them for a PIN to confirm the number. So if it was two different messages, I can understand the security. They got one by email with the PIN and one by the phone, but they deliver both together because there's no security advantage.
So we'll wonder if that was the push out from COVID, because they were meant to be separate.
Yeah, I think they just didn't think it through. But the reality is, I don't know if clinicians.
When they launched it the first time, you got two text messages. You got one with a link and one with a PIN. So I wonder if they've just stopped doing that due to COVID, just to urgency.
And even if they did do that, and if they did do it in separate messages, and maybe they still deliver it to the same mobile phone number, so it doesn't still solve the problem. You get both messages. Here's a link. Here's your PIN. So there's no security advantages. But I think, and I'm going to say to the clinicians here, because it's a video consult, when you actually do the connection and you see the patient, that is another form of verification. The PIN is just over marketed, but I do think that's the bottleneck. To cut and paste the PIN into that web browser, I think some patients will struggle, and that's my worry about it.
Thanks. There was a question from Adam around System 1 notifications and the NHSApp. Adam, do you want to ask your question in detail?
Yes, please. When a patient registers for the NHSApp, you get the linked application notification in System 1, which is great. It doesn't do a great deal, to be honest. All it does, I assume it sends an automatic text message to them, letting them know that the app's linked. But there's some patients, and I've been trying to get on top of this with my data quality team, and that patients don't have a verified number, then it will come up with that task saying cannot message patients. So then it causes you a clutter of tasks that's unactioned. So I have my data quality team to call them and verify the number, and ensure that when people are registered, they're verified, which helps problem in future. But it's a bit of a what can we do? How important are those as such?
They're not that. I mean, I don't think they're that totally important, because the patient also gets an email from the NHSApp team when they've finished the verification.
Yes.
I think this trigger is a System 1 text, basically, or System 1 email to them. And I've had the same problem that you've had. I go through it. I've sometimes been very naughty where that verification, I thought, often you get the alert that says just manually inform them, but then you get the ones that you just cannot action the task.
Complete,
which is really annoying. And I have done exactly what you've done. I've literally had to contact the patient just to verify, to action the task and then close it. So it is
a good sort of verification process, but it's a bit of a pain, especially when you get hundreds a month. We were getting quite a lot at one point, and so.
Can I say a big shout out to you guys at Hillview Surgery? I want to really praise you guys, and Adam, you need to take some credit for this. So Phil, and this is after the CCG. you are the leaders in Ealing. At the moment, our data is showing that you've got 37% of your patients having record access. I don't know if that's absolutely correct, whereas most of our practices are on 0 to 2%, and some of them, some practices are on about 9%. So in this final minute, what are you guys doing? That is so impressive.
We were sending text messages pre-COVID regarding the NHS app. So we were getting people to register via NHS app. And we are, when we register patients, asking them if they require access to their records. We've added 4 patients who are new to the practice and register online. We've set up to give them prospective access, so they have access going forward from the day that they register, not going back. We only ask them, if they request retrospective access, then we review the records retrospectively and grant that access. And we're getting patients to email. So a lot of ours aren't using Airmid, they're using the NHS app, but we're requiring them to send an email just with a copy of their documents to confirm that that is them, and then we're granting them retrospective access if they request that. So we've been quite keen with the NHS app from the start. But without the Airmid, and that's why I questioned that, without the Airmid, we aren't able to do that request online. We're having to do it manually via confirmation of documents, etc.
Yeah, and finally, I mean, that video we created, I mean, Alex has said in the chat, but we had a vision of a digital social prescriber role for the Actor Network, and our vision was that we create more of those sort of videos and how to navigate the digital world. You can look at Cloister Road Surgery for an example of how we just embed that video into the instructions for online, and everyone's welcome to copy it. You can take the YouTube link, and that was a very quick video. Hopefully the videos will be better in the future. Okay, I'm conscious we've gone over time. I know that we may have rushed. We probably spent a little bit longer than NHSApp than we originally planned because we got Patrick on, and I appreciate that Airmid was a bit rushed through. We really value your time that you've made the time to connect in with this webinar. And like I said, it's just one patient often that we want you to just try it with, and then you have a discussion with your networks about the experience. So if you have any further queries or questions, you can probably contact us offline of this webinar. But otherwise, I'll bring it to a close because we've run out of time.
Thanks, Shankar and everyone. And yeah, any more questions, we'll collate them.
Thank you, everyone.